So yeah, so we were discussing the points. First is the JW1, which is the mandible angle. Then JW2,
Yeah,
which is the preauricular. Then
yeah,
JW3, which is again the mandibular body. JW4 is
yeah,
equal to C6, and JW5 is just as C2. Uh, they overlap.
yeah.
So JW1 is the point. Don't touch the bone with the needle. Be wary of the facial artery in JW1. Sorry, in JW3. So when we are talking about JW1 in men, we go laterally because we want to broaden it. And in women, we try to hit the bone posteriorly.
What do you mean by posteriorly and laterally? Can you just show
Yeah.
on this?
In men, we are injecting like this, like we go from the side. And in women, I'm going like this from behind.
Okay, on the men we are going like this, and the females we are coming from the behind.
Yes. And now a lot of
Okay.
it depends on the bulk of the masseter muscle and the facial fat over this. Sometimes this point is not, you cannot easily reach the angle.
So what I understand is in males we are trying to increase the projection. In
Square face.
females we are trying to define it and make it little more
Yeah. So if you,
sharper.
yeah, it's sharper. So to like if somebody wants a, I have only 1 ml or maybe 2 ml and I want to define the chin and jawline. So I'll do JW1 and C2.
Okay.
So the two ends are being pulled
Okay.
and then I will do the pre-jaw.
Yeah. So in males, projection of the angle of the mandible is important, and in females, the pointedness and the definition of angle is
Yeah.
really
Yeah. So in women,
important.
we don't want to broaden the face.
Yeah. In males.
Yeah. In women, in females,
Yeah.
we don't
We
want.
don't want to broaden it. Yeah. Yeah. Got it. Yeah. Fine.
So this is how we do JW1.
Yes.
Here they're showing from anteriorly, but we usually do it either from the side or behind. Then JW2 is a point. It is pre-auricular. It is it's done with a cannula or a needle. This you inject in this area like this. Linear threading.
Yeah. So my question is that when we're doing a mid cheek, a mid face, we are also having this point CK4,
CK4.
pre-auricular point.
Yeah, yeah.
So is it coinciding with
No,
JW2?
no.
What is the difference between these 2 points, JW2 and CK4?
This is your CK4. This is your JW2. Fine?
Okay, CK4 is higher at the
Yeah.
level of the auricle, and JW2 is below that.
Yes. So JW2 is basically the mandibular bone, if you see, the posterior border of the mandible.
Yeah.
Fine?
Okay. Fine, fine. Yeah.
Then JW3 is again you pinch the skin and then
Yeah.
inject with a needle or a cannula. Right? JW4 is again pre-jaw and then JW5. So we'll be taking one by one. So JW1 recommended for men. Voluma 0.2 to 0.5 ml, needle bolus on the bone. It widens the face for masculine square-like look, square face. That is JW1. So 0.5 is the maximum you can do. What I am doing is 0.3 is the minimum is required. So active numbers are basically the minimum amount of filler that will go for the result to be appreciable.
Yeah.
Okay. So 0.3 to 0.5 is anywhere I can go.
Fine. Yeah.
Then for women, it is like this, as I said. Here they're showing anteriorly, but this is the point where you hit. You can, inject posteriorly. JW men. So in women, it will lift and define the mandibular angle. Again, voluma 0.2 ml, needle, bolus, subcute. Because most of the times, if you don't get the bone because of the hypermeseteric bulk or the facial fat, then leave it in the subcute only. But if you're doing it subcute, then 0.2 is okay. But if you're hitting the bone, then 0.3 to 0.5 is required.
Fine. When you are like working on females, uh, suppose their masseter muscles are quite strong. So
Mhm.
do you give Botox injection on the masseter muscles?
Yeah, I take it regularly. I have not taken it for quite some time, but I take Mesita regularly. And now if I take Mesita, then my jowls, they increase in visibility. So which is why I stopped taking.
Oh, so is it good to give on masseter muscles or not? We should avoid giving on masseter muscles.
Depends, if the person wants a slimmer look and the jowl is not an issue for them, and they can
Okay,
do
jowl is not an
like
issue.
filler in the jowl, they are ready for it, then go for it. And it helps
How
with.
often, yeah,
Mhm.
how often you give Botox to the masseter? Some people say every month, some people say every
No, no,
six
no, no.
months.
Once a year
Yeah.
is fine, 40 units each side, once a year will do. Because, when after doing masita, there is some weakness in the mastication. If somebody is a non-vegetarian, they have difficulty chewing. For vegetarians, it doesn't make much of a difference unless you're chewing gum. But otherwise, for non-vegetarians, it becomes a concern. They're not able to fight properly.
Okay. Fine. Yeah.
So this is how JW1 in men and women. So usually
They're
if
showing it very differently in the
they're showing
females.
it differently in the very differently. So if the face is bulky, I what I do is I do JW1 and I complete for women, I do JW1. If I'm not able to get the angle of the mandible, I just omit it that point. So just JW1 and then the pre-jowl circus.
Yeah.
Then we have JW2. It lifts the skin and reduces the jawline sagginess. We can use either Voluma or Volift. Voluma is preferred. So minimum is 0.5, maximum is 1 each side with needle or cannula, fanning, subcute. Alert zone is parotid gland.
So when you're working on JW2,
Hmm.
are you parallel to the posterior border of the mandible,
Yes,
or
overlying it. Overlying it
you're
and
overlying?
parallel.
You're close to posterior border.
No, yeah, we are close to in the X and Y axis. We are close to the posterior border, but not
Yeah,
we are in the layer is the subcute only, not on the bone.
subcute. But we're trying to be as posteriorly as possible.
Yeah, as posterior as possible.
Okay. But here in the diagram, what I see JW2, they are quite ahead of the posterior border of the mandible. Is it the right position? Look at this diagram. I think
This
it is about 2 centimeters away from the
away from.
auricle, what I can.
No,
It,
actually, if you draw the masseter, it is the,
yeah.
posterior half of the masseter, overlying it.
So is this needle diagram correct? What they're showing?
This one?
Yeah. I think it is too ahead. Shouldn't
Yeah,
it
this is
be?
too head.
Shouldn't it?
It should be somewhere here.
Yeah. This is what I'm saying.
Uh-huh.
We
Then it
have to be
should be,
little
yeah,
behind, as close to the ear as possible,
yes, close to the
as
ear.
close to the auricle as possible.
Yes. So that's why these diagrams are for, picture and photography purposes they've taken. They are not the correct
Yeah.
references. You know. Then this is how you do with needle with the cannula.
Fine. Thank you.
Then we have the mandibular body, JW3. This will improve the definition of the jawline. Voluma 0.2 to 0.5 ml, needle or a cannula, linear threading in the subcute, and very zone is facial artery. So here what you mark is you mark the anterior border of the mandible and just, anterior border of the masseter and then mark the facial artery. And behind the facial artery is your entry point. Fine.
Yeah.
So mark the facial artery over here, and behind the marking, you can go like this.
Yeah.
So this will improve the definition of the jawline. And since you're in the subcute and the facial artery is on the bone over here, so that also makes you safe being in the subcute. This. JW3 is
Yeah.
recommended in, slim faces for models and all. For my face, JW3 won't do much help.
Okay. Slim faces.
Yeah, slim faces, they want to become more edgy or more defined, models. They want a sharper jawline. There, this JW3 can work well. For, round faces, heavy faces, this point doesn't work. You cannot define this area by just putting filler over there. On the contrary, it makes it more heavier.
Yeah. My question is, mostly people who have jowls have got this area sagging down.
Hmm.
If you are putting filler, won't it sag down further?
Yeah, that's what I'm saying. For heavier faces, this doesn't work. It'll work for slimmer faces with
Yeah.
a defined chiseled look. For my face, this point wouldn't do any help. It'll make it look more bulkier. So for me, only the lifting points would help. JW2 would help. JW1 would help. This pre-jowl sulcus would help.
Yes. And when you're injecting in JW3, are you parallel to lower border or
Lower,
you are going, yeah,
parallel to lower border.
okay.
Inferiorly.
Inferiorly means in line with the,
Yeah.
uh, in line with the CK,
CK4.
I mean,
C4.
yeah,
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 C4.
yeah, in line with CK4.
Yeah, नहीं, C4, C4. CK is cheek point.
Yeah, C4. In line with C4.
C4. Fine. This will improve the definition of the jawline. So this is
Yeah.
how to do with a needle or a cannula.
Have you ever given lipolytic solutions in this jowl 3 area?
Jawline, but I've given in the, this thing, submental. For the double chin, I've given, but not in this area.
Fine. Not in this area. Okay.
Now, this is the JW4 point, is same as
Yeah.
C6, pre-jowl. Voluma, 0.1 to 0.5, needle. You can use depending upon the, expanse of this area, either a bolus or fanning doesn't work well. Bolus or linear threading on the bone. And if you're doing with cannula, then subcute fanning. But
Fine.
on the bone with needle works best over here. And this is not how you enter. You make the entry point like this. You don't enter
Right
like,
angle.
yeah,
Right angle.
45 degrees, not from beneath, 45 degrees. C2, just like C2. And then after you inject, you can do some slight molding also,
Yeah.
So that also helps. So this is with voluma and with cannula. Stin apex is C2. This again we have done, This will improve the vertical dimension. So again, the product is voluma, 0.2 to 0.5 ml with needle on the bone, on the bone, and the same like C2. This is same like C2. When you're doing just the jawline separately without the chin.
Yeah.
So that was it, I think.
Yeah.
This we have done lips and all.
Yeah.
Yeah. So anything you want to
Fine.
discuss? Because I think we're done with most of it.
Yeah. Yeah. So what else is left in fillers and face? Anything else is left?
Uh, not as much. I'll just have a look at whatever. We've done complications, we haven't done.
Complications. Yeah, that would be a good thing.
Mhm.
I think I'll see if how things are placed. Otherwise, we can have it tomorrow or maybe next week then.
You let
Okay.
me
I'll
by,
I'll I'll get back to you by evening.
yeah.
I would like to have, the PDF of these MD codes if it's possible
I'm
to
not
use
able
it
to get
clinically.
the PDF, but whatever I have, I can send you pictures of that. PDF, I'm not, I don't know.
Okay. Anything means which I can place like just
Yeah,
numbers,
yeah,
so that it can help me while injecting
got it, got it.
or
I'll
maybe
have to search
charts or
for it.
something.
Yeah, I'll have to search for it. Let me just search for it.
Fine. So by evening, I'll inform you
Mm.
if how is my schedule tomorrow. Otherwise, we can have it in the tomorrow also or next week. And I want to revise everything, today and in 2 days and
Okay, okay. So
see
then
what I
do it
can do
next week.
next week. Fine, that would be nice.
That will be fine.
Okay. And after that, would we start with Botox after complications?
Yeah, we can start with Botox.
Thank you. Okay. Yeah. Okay. Do you do
Okay.
micro Botox also?
Yeah, yeah, micro Botox, meso Botox, everything I'm doing.
Okay, fine, fine. Okay. So we'll do complication then start with Botox. Is it okay?
Sure, sure, definitely.
Thank you. Thank you,
So
Dr. Bhavna.
once you're done with the lips, no, if you've done 5 to 6 cases, then I have something advanced, like 45 injection techniques for lips. That also I have.
Fine.
That is if you
Yeah.
want to go for it. That is something which is very,
Yeah, but yeah. First, let me grasp the basics.
yeah, yeah. So that will be helpful only if you've done 5 to 10 cases of lips. Then only we can, go for that.
Boy, fine. Yeah. Okay.
Fine.
Thank you, Dr. Bhavna.
Okay, thank you. Have a great day. Bye. Take care.
Bye.